some people have the misconception that if I can just get this treated, get it taken care of, I should be good, all set. Which I would go, another question would be more based on, why do I need to learn so much about this, or why are you explaining so much about this condition to me? So the big reason I would answer that question is patient education is a huge factor when it comes to healing times, as well as the idea that realistically this is going to be a recurring issue for you. So patient education is something that I definitely focus on quite a bit with patients here. The reasoning behind that is, the more you know about your condition, the more you can identify what's causing it or creating more and more of these concerns, to be able to break that chain and break that cycle of it coming back over and over again. So in the sense of, we'll say, like a rotator cuff injury, so a shoulder injury. If I'm sleeping on that shoulder constantly, I'm going to keep having those shoulder issues, irritated over and over and over again, because I'm always rolled forward, or whatever the case may be, depending on the injury. So the same idea goes with learning about your injury, in the sense of, if I sit at a desk all day and my low back hurts, all right, if we can modify this just a little bit even, obviously you're going to keep your job and want to keep your job, well, most of the time. But being able to do your job in a slightly different way, to be able to stop irritating those same tissues over and over again, can be a big factor in the idea of how long it's going to take to improve symptoms, and that we don't want this to happen over and over and over again. So that's one reason we go over a lot of things. I try and go over anatomy and some of the physics behind what you're doing, the biomechanics of how you're moving. And if we can tweak those a little bit to be able to stop irritating the same tissues over and over and over again, we can make a big improvement in, one, we're not irritating the tissue anymore. Then we can actually do some treatment to help you get better, and you're not constantly just irritating it again. As well as recognizing, so hey, this is what's causing my injury. If I can stop doing that or change it, it's going to happen a whole lot less, because the number one predictor of injury is previous injury. So if we're just doing the same thing over again, it's just going to come back. It's just a weak chain, and that's the first place it's going to go. So definitely think that patient education is a big factor when it comes to improvements and long-term health benefits. The more you know about your condition, the better off you're going to be, in the sense of knowing what to do. And it also gives you those tools of, all right, this issue is coming back and bothering me again. What do? I have this in my tool bag to know exactly, all right, this is what I did last time and it helped. Let's do it again. And it's just going to restart. So simple concept, but again, knowing what's going on, and that's one thing that getting a good diagnosis of a medical professional, being able to identify what some of those factors are, someone to take a look at you and see how you're doing, moving, is going to be really vital to help hit those points, help them be recognizable for you, and then be able to reproduce those changes when needed as they come. So hopefully that helps. And if you're needing a little bit more understanding of what's going on and what you can do to change things, definitely hit us up here, Summit to Shore Chiropractic, and I'm Dr. Darren Howarth. Hopefully if you have any questions, let me know, and we'll talk to you soon. Have a good day.